Hello everyone, my name is Vignesh Vedaraja, and today I'll be presenting my individual research project titled The Business Impact of Innovations in Outpatient and Primary Care Services. This presentation is part of HC 6001 US Healthcare under the guidance of Professor Lily G. Wiggins. In this project, I'll explore how recent innovations have reshaped outpatient and primary care delivery in the United States. Outpatient and primary care make up the foundation of the U.S. healthcare system because they provide most preventive services, chronic disease management, and first-line patient care. Over the past decade, and especially after COVID-19, innovations such as telehealth, remote patient monitoring, retail clinics, and value-based care have rapidly expanded. The purpose of this project is to analyze the business impact of these innovations through Shi and Singh's system framework, which looks at system inputs, processes, and outcomes. I also incorporated insights from interviews with two healthcare professionals to understand real-world effects. Innovations, the key innovations in outpatient and primary care. Several major innovations have dramatically changed the delivery of outpatient and primary care. Telehealth has shown over 300% growth in virtual visits, making care more accessible. Remote patient monitoring enables real-time tracking of chronic conditions such as diabetes and hypertension. Retail clinics, often found in CVS, Walgreens, and Walmart, provide quick and low-cost alternatives to traditional office visits. Finally, value-based primary care modules focus on prevention, team-based care, and data analytics. Collectively, these innovations push care beyond the traditional in-office model and increase flexibility for both patients and providers. System inputs, technology, workforce, and financing. Using Shi and Singh's framework, the first component is systems input. From a technology standpoint, telehealth requires secure platforms, patient portals, broadband access, and strong cybersecurity. Workforce roles are also shifting. Medical assistants now help facilitate virtual visits. Nurses monitor RPM data, and providers rely heavily on digital communication tools. Financing has changed as well. Clinics now depend on a mix of telehealth billing, RPM reimbursement, and chronic care management fees. During my interviews, both professionals emphasized increased investment in new technology and the need for staff retraining to keep us up with innovation. System processes, care delivery, and coordination. In terms of system processes, outpatient care is now moving toward hybrid or virtual first workflows. Telehealth helps reduce wait times and improve scheduling flexibility. Remote patient monitoring strengthens chronic disease management by giving providers continuous data. Instead of waiting for in-person visits, value-based care improves care coordination by integrating behavioral health, care teams, and proactive outreach. Digital triage tools also help determine whether a patient needs an in-person appointment or a virtual consultation, making the care process more efficient. System outcomes, access, quality, cost, and equity. These innovations have significant impacts on system outcomes. Access has expanded for rural communities, people with disabilities, and underserved populations. Quality improves because continuous monitoring leads to early detection and better management of chronic diseases. Cost decreases. Innovations help reduce hospital admissions and emergency room use. Retail clinics increase the availability of affordable acute care. However, challenges remain. The digital divide limits telehealth adoption among older adults and lower income groups, showing that equity issues still persist. Strength of outpatient innovations. These are several major strengths associated with these innovations. Telehealth and retail clinics significantly increase accessibility. Retail patient data improves the quality of care and clinical decision making. Efficiency improves with fewer no-shows and smoother scheduling. These innovations introduce new revenue streams, particularly through chronic care management and remote monitoring billing. Finally, data driven insights help providers identify high risk patients and allocate resources more effectively. Challenges and limitations. Despite the benefits, there are challenges to consider. The digital divide remains a major barrier, particularly for elder, low income, and rural populations. Telehealth reimbursement policies remain uncertain, creating financial risk for clinics. Digital platforms require substantial upfront investment, including cybersecurity protection. Providers experience increased workload due to documentation demands and electronic messaging. Additionally, retail clinics may disrupt continuity of care because patients may bypass the primary care provider. Taking a stand. Support for innovation. In this project, I take the position that outpatient innovation should be supported and expanded. Overall, these innovations improve access, quality, efficiency, and patient engagement. Telehealth and remote monitoring reduce avoidable hospitalizations. Value based care strengthens prevention and better population health outcomes. However, for these benefits to be sustainable, policies must address digital equity and stabilize telehealth reimbursement. With the right support, these innovations can transform primary care into a more modern and equitable healthcare system. And finally, here are the references used for this presentation. They include peer-reviewed studies and articles related to telehealth, outpatient care, innovation, chronic disease management, and economic evaluations of remote monitoring. Thank you. Thank you for your patience. Have a good day. Hello, everyone.